Hey, Rodrigo, how's it going?
Hi, Caitlin. Doing fantastic. How are you?
I'm good. Thanks for joining me again.
Absolutely. It's always a pleasure.
Yep. So, we had kind of talked a little bit offline about this too, but we wanted to talk about today is, the difference between having that last 5 or 10 pounds of stubborn weight you have to lose versus potential issues with food sensitivity. How do people know how to differentiate if their issue is in fact a need for continued weight loss, or if there's some underlying things that are causing the scale per se, and maybe their midsections and whatnot to trick them into thinking that they have additional weight to lose?
Sure. And it's such a great question, Caitlin. Thank you so much for having me. I mean, it's one of the things that we like to educate patients on, the difference between maybe feeling some bloating and digestive issues and maybe feeling like you need some weight loss versus actually needing some weight loss. So one of the awesome things about what you guys do there at New Leaf Wellness is you're able to measure the patient's BMI and determine the best treatment approach for them. And that's really important because if as a patient you feel that you need weight loss, and in fact what you're experiencing may be some bloating, gas, digestive issues, diarrhea, constipation. It could be stemming from a food sensitivity, where if you come to New Leaf Wellness, you get a food sensitivity test. They're going to be able to identify exactly which foods you should eliminate that could be causing that inflammation and those issues. Versus where if you come to New Leaf Wellness and they measure your BMI, they can qualify you to see, if you're at a certain point, you can take a look at some of the weight loss solutions that you guys offer. And it's really important that sometimes it can overlap where somebody that needs weight loss is also having some gut issues as well. But usually we like to kind of be able to at first take a look at the patient and say, okay, which route, which direction do you need to go in? For weight loss, you guys have awesome solutions for that. For food sensitivity testing, it's really important to get that test if you are having those digestive issues, because you may be at a healthy BMI and you may also say, hey, I eat healthy, but if you're having some bloating, if you're having some gas, if you're having digestive issues, it could be that you think you're eating healthy, but are you eating healthy for you? And everybody's different, you know. I may react to some healthy foods that you may be okay with. You're never going to find that out without a food sensitivity test. The types of reactions that show on a food sensitivity test are somewhat hidden and delayed. So you could eat a food and right away feel crappy. You may also eat a food that you have an issue to, and you may not feel crappy until the next day, 2 or 3 or 4 days after. That's how long a sensitivity can take to react.
Yeah,
So it's really important for patients to kind of distinguish the difference. You guys are awesome because you help patients be able to say, okay, here's your BMI. These are the approaches or the routes we should go in depending on what they need.
and then we looked specifically at my test results. And I had done one a couple of years ago and decided to try another one to see what had changed. And, a couple of things that you kind of pointed out to me is, elimination is in fact elimination. It's not do it a lot less, because I had said that I eliminated dairy and then I proceeded to talk about having ice cream shortly after that. And my issue isn't weight loss, but I do notice feeling sluggish. And I do notice after eating certain foods that I bloat and things along those lines. And I think there's a lot of people that don't understand that food sensitivity is a thing, and that, just because you're not having debilitating issues that, make you not be able to function, it doesn't mean that the stuff that, a lot of times we just say, oh, that's just me, that's just how I am, because it's all we know, because we've never been without those things that are causing it. And then
Sure.
we also talked about how certain things are hidden inside medications, foods. It's important to look at what everything's made of and stuff like that, especially after you've done the test, because a lot of times, we talked about, sardines in particular, possibly being in supplementation or things along the lines that I take that, so a food could show up that you're like, oh, I never have that. And you're getting it from somewhere else and you don't realize it.
It's really important. I mean, it's eye-opening. I fit in your category as well, where I didn't need weight loss. What I needed to do was address the bloating and the digestive discomfort that I was having. I think a lot of us, as we get older, as we age, we kind of contribute some of those symptoms to just getting older, and our gut not being as, not being able to handle foods the way we used to when we were younger. But you can get back to that point by restoring the gut, by identifying the foods that trigger your gut, by eliminating those foods. And like you said, it's not a sort of elimination. Really, the better you are with it, the better success you're going to have with it. And if you rebalance the gut with beneficial bacteria, you're going to see that bloating go away. You're going to see those digestive issues go away. You do that for a short period of time and you set yourself up to go back to eating normally, and you can handle those foods again. So sometimes we need that, kind of what I like to call a temporary intervention of, let's take a look at what's going on in the gut. Let's address it. When I followed my results, when I reset and rebalanced my gut, all those issues went away. I mean, even skin issues that I was having went away. So, it's the gut really is like a second brain. It really is. And what we put in it is so important because everybody is different. So it's really important to get that food sensitivity test. If you feel like you might have, if you're struggling to lose weight, if you want to, lose those extra 5-10 pounds that you just can't shed off, could be a food sensitivity. That could restore your gut to where you end up losing the rest of that weight you want to. But New Leaf Wellness will qualify the patients as far as saying, where's your BMI at? And this is what we would recommend. So it's really important that people don't listen to all the stuff out there on social media. See a healthcare provider like, the awesome providers you guys have at New Leaf Wellness that will help the patients achieve those health goals.
Yeah, and we're all kind of growing with the times as well, because we used to let, potential patients let us know what they want to come in and talk to us about. They would say weight loss, or they would say hormones, or they would say food sensitivity, or they would say, lack of energy. And we kind of changed it to all of our visits are more considered a comprehensive visit, because that way we can kind of sit down with them and go over all their symptoms, and we can say, hey, I know you're thinking that it's this, let me show you some other potential issues, because so many of the symptoms overlap each other. And so even if we get them better in one area, if that other area is still questionable, they're not going to feel the symptoms relief that they're anticipating. So us changing to a comprehensive examination that they visit with our consultant for is really helpful, because then we can look at all different areas and we can recommend what we think is going to be best to get them feeling 100%.
And that's amazing. I mean, that's awesome. I think that attention to detail that you guys provide, that quality of care, is by far what separates you guys, I think, from so many other providers. You take a look at the big picture, you try to find the best solution given the entire big picture. Somebody that comes to you that says, I need to lose weight, and they're not really focused or thinking about the bloating, the gas, all the, the upset GI issues, gut issues, if you don't, as in your role as the clinic, you have to take a look at the big picture and say, what else is going on? Because that's really going to be able to give you the best assessment. So, I mean, I highly encourage anybody that this video reaches, if you think you need some weight loss, if you're struggling for some weight loss, if you have any gut issues, even if you have skin issues and your gut is completely fine, and you have skin issues that you're just having a hard time shedding, having a hard time getting rid of, come to New Leaf. They're going to be able to give you the whole comprehensive assessment, give you the best solution for you. And everybody's different. So not every solution is, it's not one size fits all for everybody. So somebody may benefit from doing a weight loss program. Somebody else, their BMI might be okay, and they might just need to reduce that bloating and that inflammation in the gut with a food sensitivity test. So there is a big difference. Like I said, sometimes they can overlap, but I just love that you guys do that comprehensive assessment, and that you guys have the tools to help the patients go, depending on where they are and what direction to go in.
Well, it's people like you and Biotrinetics that are helping us to be able to do what we do, because without the proper educators, our providers constantly getting, learning the ins and outs of what's going on, because things change all the time. We don't want what we know this year may be different next year. And the fact that all of us are continually learning and researching and, making sure that we know what's going on, I think that really sets us apart, and it really helps us to be able to get people to feel, really feel their absolute best and have confidence in us that we're going to make sure that we get them there.
Yeah, absolutely. And I think it's all about empowering the patients with the right information. Like you said, a patient that gets a food sensitivity test and doesn't know how to go about eliminating those foods, it really helps to give them suggestions and options for things that they can substitute. Because we are all creatures of habit. We like to eat the foods that we like to eat. And when we have to change that, it can be difficult. But if I can substitute one thing for the other, it makes it easier. And that's knowledge and information. We have a ton of experience, years and decades of experience in that. So it does make a big difference. And I think that's what really sets you guys apart as well. You go the extra mile for the patients.
Yeah. Well, we really appreciate you. And again, always a pleasure. Thanks for taking the time to chat with me.
No problem. Thank you, Caitlin.
We'll talk to you soon.
All right.
Bye.
Take care.